Hello everyone, welcome back to my channel Dr.shil's Physio Victory. Today we will discuss about the previous year questions of RRB 2025. This is the part 2. If you haven't seen the part 1 yet, please go in the playlist and check it first. Let's start. Today's first question is: inclinometers are found difficult to use over the area of option 1 cervical joint, option 2 elbow joint, option 3 hip joint, and option 4 finger joint. Here the correct answer is very easy, that is finger joint. Basically, an inclinometer measures joint motion using gravity based angular displacement. For accurate use, it requires a flat surface. Basically, it requires a flat surface, adequate length of the segment, and stable alignment with gravity. But finger joint is very small, have curved surface, and provide minimal contact area. That's why inclinometers are not used in finger joints. Next, come to question number. This is the image of inclinometer. Next, come to question number 27. Excessive postural sway when the eyes are closed is due to option 1 cerebellar ataxia, option 2 cerebral ataxia, option 3 sensory ataxia, and option 4 midbrain ataxia. Here the correct answer is option 3 sensory ataxia. Sensory ataxia, basically, first you have to understand uh, what are the postural controls. Postural controls depends on someone vision, two is vestibular system, and three is proprioception. In sensory ataxia, proprioceptive input is impaired. Patient compensate using basically vision. When eyes are closed, balance worsens dramatically. In cerebral ataxia, sway occurs even in eye closed, even with eyes open. In cerebral ataxia, not primarily related to sensory input. In midbrain ataxia, it is rare. Next, come to question number 28. How intervertebral discs obtain nutrition? Option 1, no nutrition is provided. Option 2, local diffusion. Option 3, collateral channels. And option 4, intervertebral vessels. Here, the correct answer is local diffusion. Option 2 is the correct answer. Basically, intervertebral discs are avascular structure composed of nucleus pulposus and annulus fibrosus. Nutrition occurs via diffusion from capillaries of vertebral end plates. It is enhanced by movements and loading, unloading. This is why prolonged bed rest worsens disc health. Next, come to question number 29. The flexor zone of the hand that lies over palm is option 1 zone 1, option 2 zone 2, option 3 zone 3, and option 4 zone 4. Here the correct answer is option 3 zone 3. This is the image of basically this zone is reflex palm, and this is zone 3. Next, come to question number 30. Inspiratory hold is a technique that helps improve ventilation to option 1 non-aerated alveoli, option 2 bronchioles, option 3 well aerated alveoli, and option 4 main bronchus. Here the correct answer is non-aerated alveoli, option 1. Basically, inspiratory hold is a technique, uh, deep inspiration followed by a 2 to 3 second breathe hold, which allows air to pass through collateral channels. Collateral channels are one is pores of cone, two is canals of Lambert. This helps re-expand collapsed alveoli, improve oxygenation, and prevent atelectasis. Next, come to question number 31. Which technique is not advised for lower limb massage? Option 1 effleurage, option 2 pounding, option 3 ringing, and option 4 thumb kneading. Here the correct answer is option 2 pounding. Uh, Lower limb massages focuses on improving venous and lymphatic returns and relaxes large muscle groups, avoiding excessive mechanical stress on vessels. And pounding basically produces strong impact forces, can causes discomfort, bruising, or vascular stress, especially unsafe near varicose vein or edema. Hence, it is not advised routinely. And effleurage basically is a light stroke. Light stroking improves circulation and lymphatic drainage. Ringing is suitable for large muscle groups like thigh and calf, and thumb kneading is useful for local muscle tightness. Next, come to question number 32. Mast cells and basophils are mainly involved in which one of the following process? Option 1 phagocytosis, option 2 allergic reaction, option 3 wound healing, and option 4 immunoglobulin secretion. Here the correct answer is option 2 allergic reaction. Mast cells and basophils contain histamine, heparin, and leukotrienes, which are activated by IgE mediated hypersensitivity, plays a key role in type 1 allergic reaction. Phagocytosis basically uh, mainly neutrophils, and these are neutrophils and macrophage. Wound healing is done by fibroblasts, macrophages, and platelets. And immunoglobulin, platelets, plasma cells, B lymphocyte. Next, come to question number 33. In neonates, percussion can be given through option 1, two hand, option 2, one hand, option 3, two fingers, and option 4, palmar aspect. Here, the correct answer is option 3. Two fingers are generally used because neonates have very thin chest walls, heavily uh, compliant ribs, and sensitive lung tissues. Therefore, percussion must be gentle, controlled, and localized. Next, come to question number 34. Which waveform is used in Russian currents? Option 1, square, option 2, triangular, option 3, rectangular, and option 4, hexagonal. Here, the correct answer is square. Square is used in maximum cases, but rectangular is also used, but the number is very less. So the correct answer is square because it's delivered in burst form. Next, come to question number 35. The thickness of the carpet on the floor for wheelchair users should not be more than option 1, 5 inches, option 2, 1 inches, option 3, 0.5 inches, and option 4, 0.2 inches. Here, the correct answer is option 3, 0.5 inches. Next, come to question number 36. Rigidity is a sign of option 1, peripheral lesion, option 2, pyramidal tract lesion, option 3, extrapyramidal tract lesion, and option 4, midbrain lesion. Here, the correct answer is very easy. This is a flat question. Option 3, extrapyramidal tract lesion. What is rigidity? Rigidity defines as increased muscle tone, uniform throughout the range, and it is velocity dependent. That means same resistance at slow or fast movement. It is a hallmark of extrapyramidal system involvement, commonly seen in Parkinson's and basal ganglia disorders. Peripheral lesion causes flaccidity, pyramidal tract lesion causes spasticity, and midbrain lesion causes postural changes. Next, come to question number 37. Which one of the following is not a cause of hyperthyroidism? Option 1, Graves' disease, option 2, goiter, option 3, adenoma, and option 4, myxedema. Here the correct answer is very easy. It is a 10th level question. Option 4, myxedema. Myxedema was due to hypothyroidism. Characterized by puffiness, cold intolerance, and weight gain. Next, come to question number 38. A fracture of both the superior and inferior pubic rami is called a option 1 kissing fracture, option 2 aviator's fracture, option 3 straddle fracture, option 4 Laur's fracture. Here the correct answer is option 3 straddle fracture, which involves both superior and inferior pubic rami, uh, usually bilateral. Kissing fracture is basically seen in knee joint. Aviator's fracture is fracture of neck of talus. Darvas fracture is stress fracture of pubic ramus. Next, come to question number 39. Which statement most accurately defines a phobia? Option A, option 1, a persistent and irrational fear tied to a specific object or a situation. Option 2, ongoing distress and unease without a clear trigger. Option 3, fear that occurs due to actual danger in the environment. Option 4, sudden episode of extreme fear that resolves quickly. Here, the correct answer is option A, option 1, persistent and irrational fear. Basically, this word comes under phobia. Next, come to question number 40. Moderate osteophytes with definite narrowing of joint space with sclerosis and noted deformity is graded as dash in Kelvin-Lorentz scale. Option 1 grade 2, option 2 grade 4, option 3 grade 1, and option 4 grade 3. Here the correct answer is option 4 grade 4. Uh, in Kelvin-Lorentz scale, grade 1 is doubtful, narrowing, possible. Osteophytes, grade 3 is moderate osteophytes, definite narrowing, sclerosis, and deformity. Grade 2 is definite osteophyte, possible narrowing. Grade 4 is severe narrowing, large osteophytes, and severe deformity. Next, come to question number 41. During the straight leg raise test, when the patient complains of pain above 70 degree, it indicates option 1 disc prolapse. Option 2, sacroiliac joint involvement. Option 3, lumbar spine fracture. And option 4, avascular necrosis of the hip. Here, the correct answer is option 2, sacroiliac joint involvement. Basically, 30 to 70 degree is lumbar disc prolapse. 30 to 70 degree. Pain in 30 to 70 degrees derived as disc prolapse. Lumbar fracture. In lumbar fracture, pain is consistent, not angle dependent, and avascular necrosis of hip causes groin pain. Next, come to question number 42. Indication for elbow arthroplasty is option 1, osteoarthritis, option 2, ankylosing spondylitis, option 3, tennis elbow, and option 4, rheumatoid arthritis. Here, the correct answer is option 4, rheumatoid arthritis. Elbow arthroplasty is indicated when there is severe pain, joint destruction, and functional loss. Basically, in rheumatoid arthritis, chronic synovitis is present, progressive cartilage destruction, and deformity and instability is there in rheumatoid arthritis. Next, come to question number 43. Which is the least beneficial position in children to optimize respiratory function? Option 1, half sitting. Option 2, supine lying. Option 3, prone lying. And option 4, side lying. Here, the correct answer is option 2, supine lying. In children, diaphragm is the primary muscle of respiration. Supine position increases abdominal pressure on diaphragm and reduces functional residual capacity, which also decreases the lung expansion. And half lying is the best for lung expansion. Prone lying is basically used in ICU. Next, come to question number 44. Thumb flexion is the movement that takes place at the option 1, coronal axis, option 2, sagittal axis, option 3, transverse axis, and option 4, frontal axis. Here, the correct answer is option 2, sagittal axis. ये वाला क्वेश्चन का भी आंसर की में एक्चुअल आंसर की में गलत दिया हुआ था, फ्रंटल एक्सिस था, जो कि बाद में करेक्शन कर दिया गया और द करेक्ट आंसर इज sagittal axis. Next, question number 45. The main characteristic of reversible cell injury is option 1, mitochondrial rupture, option 2, ATP depletion and cell swelling, option 3, loss of cell membrane integrity, and option 4, nuclear fragmentation. Here, the correct answer is option 2, ATP depletion and cell swelling. Reversible cell injury occurs due to reduced ATP production, failure of सोडियम लिख देता हूं मैं यहाँ पे, reduced ATP production, failure of sodium potassium pump, and water influx, which leads to cell swelling. Here, cell membranes remain intact, damage can still be reversed. In mitochondrial rupture, it is a irreversible injury, loss of cell membrane integrity, which is a hallmark of necrosis, nuclear fragmentation is also seen in apoptosis or necrosis. Next, come to question number 46. Monosaccharides that differ only in the configuration around one specific carbon atom are called as option 1 epimer, option 2 enantiomer, option 3 diisomer, option 4 erisomer. Here the correct answer is epimer. Is a class 11th level question. Next, come to question number 47. Notable feature of lumbar canal stenosis is option 1 pain in buttock following walking, option 2 pain during stoop posture, option 3 pain in forward bending, and option 4 pain during uphill walking. Here the correct answer is pain during stoop posture. Next, come to question number 48. In a sampling method where a part of information is collected from the whole sample and part of the subsample, it is termed as option 1 multiphase sampling, option 2 simple random sampling, option 3 cluster sampling, and option 4 uh, stratified sampling. Here the correct answer is option 1 multiphase sampling, because in question there is information taken collected from whole sample and part of the subsample. That is it. That's why it is called multiphase sampling. Next, come to question number 49. When statistical data is used to test the hypothesis, which type of statistics would be appropriate? Option 1 inferential statistics, option 2 predictive analysis, option 3 descriptive, and option 4 causal analysis. Here the correct answer is option 1 inferential statistics. Inferential statistics is drawn conclusion about a population from a sample. Used for hypothesis testing include t-test, chi-square test, ANOVA test, etc. Predictive analysis, forecasting basically future trend. Forecasting future trend. Descriptive statistics summarizes data analysis, which is mean and standard deviation. Next, come to question number 50. Glossopharyngeal breathing is most indicated in the condition of option 1 hemiplegia, option 2 Parkinson's, option 3 spinal cord injury, and option 4 Guillain-Barré syndrome. Here the correct answer is option 3 spinal cord injury. Glossopharyngeal breathing uses tongue and pharyngeal muscles, gulps air into the lung, increases vital capacity. Thank you everyone for watching this video. Please do like and subscribe to my channel.